Yes.
And doctor, how do you treat scoliosis?
Scoliosis. Very good question. We've been treating scoliosis in our office since I was out of school back in 1999. We actually have a plan, a program for scoliosis patients. It is not just structural, it's also neurological. So we take a look at the patient from the perspective of they are not just a stack of bones. Oftentimes when they put the rods in, when they put the cage in the spine, what happens? There's no more movement whatsoever. And we don't want that because that's just like putting a cast on a leg, only forever. And I recently saw someone that I had known years ago had those the rods put in, and all that she had left movement-wise was the upper neck. And years later, now, she only had movement where she could tip her head up like this or in the forward position. And she had to rock it up like that in order to get it there. And now she's actually in like a halo circle collar, like what that they have for spinal cord injuries. Jay Burson, who played for Ohio State. I'm from Ohio, of course, so they had those screwed in the halo collar. So we don't want to just fuse them, obviously. We don't want to have to send them that direction. So some of the things that I've done is incorporate the basic structural chiropractic. Okay, so that's kind of the simple stuff. We have low impact techniques to address the high sides of the curve. When you have scoliosis, you've got curve like that from front to back, kind of a tipping. And then we can address the high parts of the curve to bring it back into balance, as well as spinal decompression that we've used for over 4 years now. And that is it's a type of traction, but it's a high-tech type of traction that we use to gently stretch the spinal column. The patient holds on up at the top with their arms, and then the bottom is hooked into the table, and that applies a stretching force in order to basically straighten that out. Just like if a crooked rope or a cable was laying on the floor right there, and you pull one end, someone else pulls the other, it straightens that out. But also neurologically, that kind of the finding is that the cerebellum, back part of the brain stem there, that's involved with balance, coordination, and fine motor movement, as well as eye control, that when the cerebellum is off, especially the midline, the vestigial nucleus, that is a common occurrence. So if you address the cerebellum as well, which is what today's seminar was all about with Dr. Carlson, that if you address the cerebellum, looking for eye movements, looking for balance, coordination, that you're going to find consistent findings on one side or the other, one nucleus or the other of the cerebellum. So in our office, we use a three-prong approach, and of course we have them doing exercises and nutrition as well, kind of common sense stuff.